Hi, I'm Julie. I'm editor-in-chief of Well by Northwell, and we are here with Dr. David Purow, gastroenterologist for Northwell Health and gut expert. And the internet has a million questions about gut health, so you're in the hot seat. Are you ready?
I'm ready. Let's go.
Okay. First is about bloating. What are the causes? What are the remedies?
All right, so the top causes of bloating are going to be things that can be affected our diet, so things we're ingesting, so drinking beer and soda all day. Shouldn't be surprised that you're getting bloated because those are carbonated beverages that have obviously some extra gas in them as we're ingesting them. Another potential cause is going to be that our microbiome is off. We all have good organisms that live in our GI tract and are good, and they help us with digestion. If that gets disrupted for any reason, that might increase our bloating. In addition, any significant change in bowel movement, so people that are constipated or having diarrhea can also be bloated as a result. If we can help patients have more regular bowel movements, so taking probiotics, changing their diet, and working on their bowel movements are all things that can help decrease patients' bloating.
Colostomy bag. What is it and how does it work?
So this is a colostomy bag. There's reasons to do this include that we don't want the bowel contents to be passing through an inflamed area of the intestine or a blockage in the intestine. Typically colostomies are going to be temporary. So what basically is this basic loop of intestine that's outside the abdominal wall, and this is going to go right over it, and the waste comes here and gets drained out the bottom. These can get changed frequently, and and a lot of ostomies are actually just temporary, as a temporary solution to a medical concern. So patients may have one for several months. There are other patients who need them permanently, but actually studies show that when patients end up with a permanent ostomy, their quality of life actually improves compared to the medical condition for which it was placed in the first.
So I've heard about little cameras that you can swallow and doctors can see what's going on inside. I happen to have one right here. How does it work?
This is a little capsule that patients will swallow. The reason we would do this is to evaluate the small intestine. There are many, many feet of the small intestine we can't easily see. So if someone has an unexplained anemia or we're looking for another inflammatory disease, they can swallow this capsule. It takes tens of thousands of images as it passes through the small intestine, gets sent to a data recorder. The patient comes back at the end of the day to drop off the data recorder, and then the images get uploaded, and we could basically watch a movie of someone's small intestine.
So no need to fish it out at the end of the day?
No, we do not want this back. We want to know that it's been passed, that it didn't get stuck anywhere, but we do not need it back. Thank you, though.
Asking for a friend. Why is it so hard to poop when you're not at home?
It's a great question. I'm glad that you used home because this comes up a lot. I have a lot of patients who will go on vacation and don't have a bowel movement the whole time that they're away. What I basically say is that they're used to the home court advantage.
So it's psychological?
Yes, very much so. It all has to do with people being comfortable in order to have a bowel movement. If they're in a situation that they're not comfortable, then they may not be able to have a bowel movement.
I'll tell my friend. Thank you for answering our questions. Really appreciate it.
Happy to help. It's been fun.